Thanks for joining. This is October 28th. We're meeting for Public Health Advisory Council meeting. Looks like we have our council members and some health department staff here with us. So I will call to order at this point. Do we have any new items to add to the agenda? No, doesn't look like it. Okay. Public comment. I don't think we do. Nobody. Yep. Okay, so we'll move forward with Julie's director's report, please.
Okay, I'm going to attempt to share my screen. Can you guys, oh wait, hold on. Share. Okay, can you see my screen?
It's a blank blue screen. Okay.
Yeah.
I just want to add, I will be taking minutes today because Michelle's not here and she's pretty busy with whatever she has to do for the health department. We totally understand. So I will just take minutes today for our meeting.
Okay. Okay. Sounds good. Can you all see it okay?
Yeah.
Okay. I'm going to go ahead. So I just have a short update and then I'll turn it over to the program supervisors and have them give their individual updates. I always start with COVID updates. So I'm going to give you the numbers. As of today, we've had 37 new cases since our update on Monday. That brings us to a total of 2,177 confirmed positives. 100 of those are active. We've had 2,066 recover. We've had a total of 17,484 negative tests in the county so far. Our percent positive was declining for about 7 weeks. And then last week we saw a bit of a spike. We went up to 7.7%. That's up from 5.0% from the previous week. We currently have 2 COVID positive patients in the hospital at this time. Both are in the ICU. We are tracking 5 outbreaks currently in the county. As far as holiday guidance, we've gotten some questions about like Halloween guidance and what we're going to do for Thanksgiving and Christmas. We'll be actually piggybacking off of the university and messaging about what is considered risky over the holidays and ways to stay safe but still enjoy the holidays. We've also amped up our free testing. So we've really done quite a few free testing. We've offered 9 different free testing in the community since this started. We're actually offering another one next week. But we're hoping to add one or have one every week or every other week. We're working with KDHE and the Kansas National Guard to be able to do that. So stay tuned on that. We're hoping just to amp that up a little bit so that we can kind of see the effects from the holidays and flu season coming up. As far as the future, I'm going to talk a little bit about the vaccine, and then we will continue to release information every Monday, Wednesday, and Friday to the public, and K-Man updates on Thursdays at 7 a.m. And of course, we'll continue to update our Facebook page and website regularly. So as far as the vaccine, you all know that vaccine trials are underway. And as you all know, there's a lot that goes into that. So they, of course, want to make sure that it's safe and effective. Those are the 2 things we really need to make sure of. As far as the rollout, it could be very complicated since this is happening rather quickly. And it takes a lot of planning now so that we can be ready for that to come out. We're looking at possibly early spring that we can actually have our hands on that vaccine. Wow. I did apply to be on the Vaccine Advisory Council with the state and I was accepted. I don't know if they just didn't have many people apply or if I just got lucky and got accepted.
Nobody's fighting to be on the council.
Yeah, I know. That's me. So our first meeting was last week, and then we'll have one weekly from there on out. Some consideration when rolling this out, the vaccination out, we'll be looking at priority groups such as first responders, healthcare providers, and those at high risk. Tracking will be an issue if this is a multi-dose vaccine, which it's looking more like it. There will be at least 2 doses. And of course, it will be labor intensive, as you all are probably aware of that. So it won't be just the health department. We'll have hospitals and pharmacies and whatnot. But there is actually a vaccination plan that's available on the KDHE website. So if you go to kdheks.gov, you can view that vaccination plan. And that I'm sure will be changing as well. As far as grants, I may steal some thunder from some of the supervisors with this, but just wanted you to be aware of our most recent grants that we've received. MCH did receive full funding from the Technologies for Families grant. This is to make home visiting much easier and safer by providing families with a device and internet connection so they can continue home visiting virtually. The next two grants, I believe Jan may have mentioned last month, so it might be a repeat, and I apologize for that. But just some background on that. We have a system that we subscribe to called IRIS. It's Integrated Referral and Intake System. Many of you are aware of that and probably work with that. It was implemented in Riley County in May of 2018, and it was introduced, supported, and implemented by the Kansas Children's Cabinet and Trust Fund. We currently have 41 organizations participating with IRIS, and we're working to continue efforts to engage more organizations and to collaborate with Potawatomi County. So an opportunity to apply for funding to cover our annual IRIS maintenance costs was made available through the Kansas Kids MAP Pediatric Mental Health, and that is a federally funded telehealth access program. We did receive our full ask for that to cover maintenance fees through 2021. So we were excited to receive that just yesterday. And then we're still waiting to hear back from two others. Recently, the Kansas Children's Cabinet and Trust Fund made funds available through subgrants of the Federal Preschool Development Grant. And these subgrants are designed to help address several community needs. So we did apply for two of these, Connecting Families to Services and Improved Quality of Care. The Connecting Families to Services grant application was written to assist our IRIS program and to be able to expand the use of IRIS. So to do this, we'll need to hire a community coordinator. So we've applied for $57,000 to include one FTE position, and they'll be under Jan's supervision in the Raising Riley program. The Quality Care grant will help to provide comprehensive training for family child care providers free of charge in the areas of mental health, social emotional development, culturally responsive practices, and business management. And parents will be invited to participate in many of those trainings. So both of these are 3-year renewable yearly grants. So we're still waiting to hear back from those. We also applied for an injury prevention grant through the MCH program. Breva applied for $5,000 to be used for thermometers, first aid kits, fire extinguishers, portable door locks, and baby gates. The whole goal of that program is to reduce unintentional injury, deaths, and hospitalizations. So we have yet to hear back from that to see if we got full funding for that. And then save the date. We do have that free testing coming up again next Thursday. We're offering 2 times, 11 to 1, and then 5 to 7. And that will be at Seco Park, the barns right there by Part Hall. We used that location one time when we had bad weather here in the past, and it seemed to work really well. So we're hoping that that goes well this time. And like I said, we're looking at hopefully being able to offer this weekly or every other week from here on out. And that is all I have. Any questions?
What is a portable door lock? Just for my own curiosity.
Breva, you want to tell them?
So it's something you could take with you to, say, like a hotel room, or maybe they're going to stay the night at grandparents' house. You know, it's not actually like physically bolted into the door like some of the locks are. It's more mobile and you can take it with you.
Okay, thank you. I didn't know that was a thing.
Stop share. Okay. All right. If there's no other, or did anyone else have any questions?
Julie, I was going to ask, this is Ellen, I was going to ask you a question on that committee for vaccine rollout for KDHE. Is there someone from the CDC going to be on that, or are they receiving input from CDC and then sharing with you, or both?
I don't know that anyone from the CDC is on there. I think they're sharing information. They have, the CDC is actually reviewing the plan right now. So yeah, I don't think anyone from the CDC is on there right now. And I couldn't tell you who all's on there right off the top of my head, but it is on the CALD website. So the Kansas Association of Local Health Departments, it has it on there, who all's on that web or on that council.
Okay, yep, thank you. And thanks for being on it.
Yeah.
So Julie, what information, I mean, so you kind of know that it's multi-dose, you said? Maybe 2, maybe?
Yeah.
Okay. And looking at spring, so that's kind of the information that you have so far?
Yep, that's what I have so far. Yeah. And that would be the earliest. They said early spring would be the earliest that we would get it. That's what they're telling us. So
That's good news. That's good news.
Yeah.
Let's see, any other questions for Julie?
Just a general question, which is, is there anything that we as a Public Health Advisory Committee can be doing to support you or to support the health department in this really important work that's being done in Riley County?
that's a good question, Robin. I'm sure there are things. I just can't think of them right now, other than continuing to, just spread the message. Spread the message, not the virus. Keep spreading what we put out through our Facebook and website. I think we get so many people that will call us or email us. There's misinformation, just stuff that they hear out there, and I think that's been going on since the start of all this. So I think it could help that way. But I don't know, Renee or anyone else, if you have any other ideas or ways the advisory board could help.
I would say that hi everybody, my name's Erin. I'm the new clinic supervisor here at the health department. I think that when we do have the vaccine available, we'll probably be in need of people's help with screening to get the paperwork accomplished before they get to the nurses and EMS or whoever is actually administering the vaccine. So eventually that could be a need that we would have.
Another thing that I can think of right now, we're under order 18 is in place right now. And I know some of the commissioners have gotten some, emails and calls from the business sector that, to drop that or to amend that in some way. So right now, I think it's not a good time to do that. I think order 18 should still be in place. It seems to be working, and our numbers haven't stabilized across Kansas and have been going up. And so we need to, I think, just stay the course. And so I think if it ever came down to it, maybe a letter on behalf of the board to the commissioners to support that might be needed. So I can keep you posted on that.
Okay.
Are the commissioners leaning towards removing the health order?
Yeah, we had talked about it, or they had talked about it. And so, I think it's too soon right now for them to make that decision, but it might come up again in the near future. So.
Okay. I was gonna ask, did you guys just have the Oktober Fest? I don't want to jump ahead if someone's gonna speak on it, but I guess with the health order coming off, which we don't want that to happen just yet, especially with the flu season. How was the turnout with that?
Yeah, Erin, you want to go ahead?
Sure. So this Oktoberfest was a little bit different. This is the first year that we've ever done drive-through vaccinations, and we vaccinated 241 people last Thursday, which that number is certainly down from previous years. The previous year we had done roughly 500. Julie, you can correct me if that number is a little bit off, but our numbers are certainly down.
Okay. And was that the only thing that was going on with that Oktoberfest that was happening last week?
We didn't have the traditional games and activities for children and a lot of the things that draw people into that event. We have had other flu events, in total 10 across the county, places such as Northview at the Vineyard Church there, also Riley and Randolph. And then also flu shots are available via drive-through in the health department parking lot on a daily basis.
Good to know.
And yeah, I apologize. I forgot to introduce Erin. She started, how long have you been here, Erin? Maybe 3 weeks?
This is my third week.
Okay. So we're very happy to have her on board.
Thanks. It's nice to meet you all via Zoom.
Okay.
That could be a good segue into going around to all the supervisors. Erin, I don't know if you have anything else that you'd like to report on.
Sure. I was going to tell everyone, I'm not sure what the last meeting entailed, but we are currently interviewing for a public health nurse. We're down one position. But we have been fortunate to have 4 temp workers from interim healthcare available to help us with the flu mission and some of the other things that we've had going on. And we've already talked about flu. We did apply for $25,000 in funding for LARC, so the long-acting reversible contraceptives. Our nurse practitioner is trained to go ahead and put those in. And so we have had some appointments where the LARCs are available same day, which is pretty great for our clients. And then we recently, this week, got a list of over 2,400 patients in Riley County that receive Medicaid. And this report was on HEDIS measures. And we have a lot of individuals that we need to contact to ensure that they get updated on whatever particular HEDIS measure was, whether it's a child vaccination or cancer screening, whatever the case may be. But we're hoping that our interim healthcare nurses can help with that. And then the last thing I wanted to tell everyone is that we have rapid Abbott COVID-19 swabbing machines. So one project that's underway is getting that up and running, getting everybody trained so that if there are uninsured individuals in the community that do need testing, that we can provide that service. We have swabbed over about 40 first responders in the past week, and that was with David Adams and Renee. So that was a big undertaking, and we're hoping to expand further.
And that needs appointments or like
It
the
is.
doctor's recommendation or something? What is
So that is not something that we are advertising yet. It's still a work in progress. But the hope would be that anyone with health insurance would go to their primary care provider or KStat, someplace that does accept insurance, and then the health department would care for the uninsured in the community. But that's not set in stone yet. So yeah. It's work in progress.
That's great. And how many do you guys have on hand for that?
Well, we have 5 total, but not all on site at the health department. There's one that's headed to Pediatric Associates, and then Dr. Hurl's office has one as well. And then we'll see how many remain at the health department.
Okay, thank you.
I have a question. Something that you said made me think about the concept of an exposure location. And I know that KDHE has been reporting on exposure locations. And if I'm remembering right, it's outbreaks within the last 14 days where there have been at least 5 infections resulting. How is an exposure location and an outbreak location, are those the same thing? Are they different things? Do we track exposure location? I mean, I assume that if we had exposure locations in Riley County, KDHE would be reporting on those. I don't know if this is a question for Julie or who it's a question for, but
I think I can answer that one. So a lot of the information KDHE gets is from us, actually. I work with my team of contact tracers, and I am talking with Julie daily. We go through everything that we get. We go through all the, like right now, I have been the one who's I've, with the help of my contact tracing teams, have been notified or noticed our recent outbreaks, and we quickly let KDHE know. We have a couple of outbreaks that don't meet the public declared status, which is 5 or more cases. So there are some that we are tracking that are not public because it's 2 to 4 cases. Anything over 5 would be announced publicly. So we do watch those, we do track those, and we put those out. I think we've been putting those out 3 days a week, Monday, Wednesday, Friday. I send out my outbreak list and kind of track it. If we see a location that we are starting to be questionable, we'll definitely make sure that when we are talking, when our contact tracers are talking with each person, because they go through an entire disease investigation. So anytime we get a positive case, it's not just us contacting that positive case and asking them, you know, their locations of where they've been and them trying to remember, but then we also are contacting their close contacts to find out who and where they have been and trying to really figure out that branch and that tree. But then as we get other people that test positive that may have been related to that person or at the same locations, we start, the more locations people tell us, we're feeding that into our system, and it kind of tells us, okay, now we know we've got 3 or 4 here. Okay, this may be a potential outbreak. So we start looking to see, are there any other cases associated with that? So we really are doing a really pretty good job of it. I think what we're really excited about is we've been working towards this Esri program. And once we put in an address in Esri, it'll be basically geo, we're using all this geo data. So if we put in like Carlos O'Kelly's or a school or a workplace, it's going to now be able to tell us, was this a work exposure? Was this a, you know, just somebody went shopping and so this isn't their normal everyday location, they were just in and out? Was this a home of residence? It's going to give us all these different types of locations in different color codes, so we know, okay, these were work exposures, so this is potentially an outbreak, or this person was there, so we'll watch for other cases that may be associated with that location. So it's really kind of exciting to see how it's all coming together. And I think we're going to be able to give a lot more data and a lot more locations once that new system is fully in force. So we're hoping, we're praying, fingers crossed, to be live with that, starting to actually start using it and inputting all of our new data into it within the next 2 weeks. So we've worked really hard to try to make sure we're getting what we need out of it.
I think to piggyback off of Renee's answer, the CDC definition of outbreak is 2 or more COVID positive cases that are linked. So then it becomes more, KDHE kind of gets a little more involved when it becomes 5. And then they start reporting.
Yeah. Well, I've been looking at the KDH website at those cluster locations for the last couple of weeks, and I've never seen Riley County listed. And I saw that it was 5 or more within the last 14 days. And so I assumed that that meant that we haven't had, or that we don't have anything that meets the definition. And I know that that's a new strategy or a new way that KDHE is counting things. So am I square on all that? Is my understanding correct?
I think it is. We are reporting what information, so I don't know how often they update their information, because I know that I have sent in 2 new outbreak locations. Obviously, our wedding that was on the 17th, I believe, and then I actually just sent in for a new outbreak location. So I don't know if they are, the wedding obviously is going to be, well, they can attribute to a location. So that's probably why, because it gives up that privacy of those patients, because it's pretty easy to look in the paper and other advertised areas that people put at wedding announcements. If you look at a date and a location, you can figure out who it is. So then it potentially would give away patient information. So I'm assuming that's probably one of the reasons why that one specifically is not out there. And other than the 2 weddings and K-State football, I mean, we really haven't had most of our outbreaks are expiring. We have a few that we're following that are not quite at that 4, they're at 4 cases, not at the 5. So it wouldn't be, KDHE is tracking them on the outbreak status internally, but it wouldn't be advertised externally.
Okay, yeah. Thank you.
I'm sorry. I was
Sorry,
gonna,
go ahead.
I think I saw that CDC had a new definition for close contact. So is that the new definition you guys are using? No, okay.
We're still going by KDHE guidance.
Okay.
KDHE did say that they are looking at that, and until they actually change their guidance, that CDC guideline was put out last Wednesday, Julie. So I sat in a meeting with KDHE on Thursday where they were talking about that. They are looking over that guidance as well as some other guidance, because I think if they're going to make some changes, they'll probably make several changes because they're looking at a lot of the school stuff as well. So I think that they're really trying to look at it and make sure that definition is what they want to go with. And then Julie will decide from there.
Okay, thank you.
Erin, did you have anything else?
No, I don't believe so, unless anybody had any questions for me.
Breva, do you want to go next?
Sure. I'm Breva Spencer, the maternal and child health supervisor, and we are just status quo pretty much. We're just seeing clients in the office, at their home, or via Zoom, depending on their comfort level or abilities at this time. We did receive the Tech for Families grant, so that's exciting. We're getting those out to families. They either get an iPad or a phone card for data and minutes, depending on their carrier. So let's see what else. And we're also, we receive Memorial Hospital Association funding, so you might hear our radio advertisement on 103.5, so be listening for that. We're excited. I heard it the other night and I made everyone in the car be quiet so I could hear it. So that was exciting. And we're also still giving out incentives for our Becoming a Mom classes. We're really pushing those, and we're doing those via Zoom, not in person. And we've had a lot of participation and people telling us it's something they probably wouldn't have done if they would have had to come in person. So we're excited to probably continue offering that in a virtual format, even after we hopefully can at some point go back to in-person trainings. We're also going to provide a screen-free parenting class after the first of the year. So our nurse is working on that as well. And then we're looking at doing infant massage via Zoom, which will be a little bit different because infant massage obviously is more hands-on, but we're going to try to do a different approach so that we can provide that virtually for our clients. I think that's pretty much all I have.
All right, there aren't any questions for Breva. Heather, do you want to go next?
Sure, I'm Heather Ritchie, the Child Care Licensing Supervisor. We've been changing some things that we've done just with COVID. We've started doing Zoom orientations, which kind of like Breva said, I think we're going to keep those. They seem to be working well. And with having 5 counties and we're not having people have to travel to do an orientation, they have to have an orientation before they can apply for their license. So that's worked out really well with not having to have people travel. And so I think we'll be keeping that after COVID, if COVID ever goes away. But and then next week, we're really excited. We're going to have some Zoom provider meetings. So Tuesday, we're going to have a Zoom meeting with our center directors, just where they can come together. We're going to talk about COVID. If they have some questions, talk about success stories or how they've handled situations, and just kind of share information together. And then we're doing the same Thursday evening with our home providers, letting them get on and just talk with us, ask questions, and socialize a little bit with each other and just share ideas. We also ordered fingerprinting equipment, and I was trained on how to do the fingerprinting. So once we get our equipment, we'll be able to start providing that service to our providers as well in the evenings, and we'll do like appointment only. And it'll be cheaper than at least our Riley County providers. It'll be a lot cheaper than what they're having to pay now locally to get fingerprinted. So we're excited to be able to do that for them. Other than that, we're still PHAC, we are still not doing annual surveys. We're doing complaints, compliances, initials, but they have us holding off on annuals for right now. And that's all I have.
All right, any questions for Heather?
Heather, I did have a question. This is Ellen. I was on a call with KDHE a couple of weeks ago on another topic, but we did briefly talk about childcare health consultants that they have some training for, and I didn't know if that was something that Riley County has or has thought about more training for employees of the health department, or if that would be a benefit at all.
Well, any of our providers, we've passed that information along. That's a statewide program. So we have passed that along to our providers and hoping that they'll participate. I think we also had a Zoom with them a couple weeks ago. Casito and Kits are the ones kind of putting that together. They seem to have quite a bit of people already involved. And hopefully they'll be able to continue that program.
Yeah, great. Thank you.
You're welcome.
All right, Jan, you want to go next?
Sure. I'm Jan Steidemann. I'm the Raising Riley coordinator. We've received 5 new applications for scholarships in October. Our staff's going to be attending the virtual presentation from the National Association for the Education of Young Children Conference. It's in November, and it's a really great opportunity for all of us. It's usually a kind of a really expensive training with a lot of travel involved. So we're all looking forward to getting to see some really great professional presentations from that. Our new parent education curriculum training starts in November. It's been postponed and rescheduled several times, and they finally decided to go with a virtual presentation. So they're going to get that started, and we're excited to get that in place as soon as we can. And then I'm collaborating with Elizabeth Nelson with the USD 383 Early Learning community to put together a community kindergarten readiness team that's going to represent USD 383 at the statewide kindergarten readiness summit on November 13th. Our team consists of 11 people that are invested in early childhood and elementary education. We have representatives from USD 383 Early Learning and elementary administrators and staff. And then we also have representatives from the family child care and the center-based child care programs and parents. So the goal is to create an implementation plan to help ensure smooth transitions from the early childhood setting into the kindergarten setting. That's all. Everything else is as normal.
Okay, any questions for Jan? Hey, and Kaylin, she's our WIC supervisor. She's not able to be on here, but she just said it's business as usual. They're continuing with their telehealth method of seeing clients. So we currently don't have our doors open for WIC just yet. So we're continuing that way. It seems to be working. So Jenny, you can take it back.
All right, thank you for all the updates. I was gonna ask our council people to maybe tell us, since you guys are in mental health and vet med and health promotion at K-State, Fort Riley, if you guys are seeing some things that maybe as PHAC that we can help with, or public health issues that you guys are seeing other than COVID, I guess, but if it's related to COVID, please tell us so we can kind of know what's going on in your world. We can start with Robin. Can we start with you?
So what we're seeing is that people are finally starting to acknowledge that they're needing mental health services. At the front end of the pandemic, I guess the state of emergency was declared in Kansas on March 12th. We had our doors closed by April 4th. So it took us about 3 weeks between the state of emergency declaration and closing the doors for us to move to televideo. But, during that period of time, we moved all of our new client paperwork went online. All of our services were available online. And everything was pretty much exclusively that for about 90 days. So between April 4th and July 1st. But what we saw was there was significant reduction in demand for services, which was really shocking. I think we expected that people would just be clamoring for help. but that wasn't the case on the front end. And so the number of new folks that were requesting services went down. The number of people who were in services, there were some areas where we saw increased attendance, med services, for example. We saw increased attendance at med appointments, but especially our community-based services, and this kind of makes sense. You know, the services that are provided out in the community or in homes, those dropped pretty significantly. But even after we reopened our doors July 1st, there was still kind of a softening in the number of people that were reaching out and requesting services. And I think it was about a month ago, we saw a dramatic spike in the number of people contacting us for the first time requesting services. So much so that we really have been struggling to get people in a timely manner. And it seems, and I can't tell you why, you know, my thoughts really are speculative in nature. I just think that on the front end, people had no idea what it was we were dealing with and really thought that it was going to come and go. And that, you know, once it came and went, then life was just going to get back to normal and that they were just going to hold on for a little while. And it's become pretty obvious that this isn't just going to come and go, that it's going to be here for a while and it's going to affect our lives for a while. And so I think people are finally maybe realizing that and starting to acknowledge that it is taking its toll on their mental health. And so folks are reaching out. And so now the challenge for us is being able to respond to all the requests for services. And this has been I've been primarily focusing just about the office-based services. We, of course, still aren't able to do everything that we could in the community with our youth rehabilitation services. We are providing some services. It's just not at the same level as it was before COVID. The crisis stabilization unit was one part of our service that remained open the entire time. We never closed the CSU. And the need for the CSU never was diminished as a result of the virus. Right from all along, there's been high demand for those services. And we have seen an increase in the demand for crisis assessments. You know, because we just have 11 beds, our bed days remain about the same because mostly we've been busy and full. But the number of people who have been requesting assessments has gone up pretty dramatically, which means those folks are needing to be referred out for other services. Some of them may be able to be diverted back to the community for outpatient services. Some of them are being referred on to the state psychiatric hospital or to private psychiatric hospitals. So it's been interesting. And I do think we, again, just in the last 30 days have started to see sort of a change in terms of the acknowledgement of need and actually then taking action to do something about it. So, you know, we are a little bit concerned about what's going to happen this winter when the weather gets cold and people aren't able to socially distance by being outdoors, or they aren't able to socialize in a socially distant way outdoors.
Right.
And so I think if you've participated, and I know Julie has participated in the recovery task force, the Manhattan area recovery task force. And we did at the last meeting talk about maybe working on a mental health campaign that encourages people or that gives them some ideas of things that they can do over the winter months when we aren't going to be out and about so much. So that's something I think that we'll work on, and hopefully it won't just be a Pawnee initiative, but will be something that the Recovery Task Force, the Chamber of Commerce, and other interested parties will work on together to kind of keep people inspired and optimistic and hopeful during this time.
Okay. Thanks, Robin.
Yep.
Let's see. Ben, do you want to tell us something about Fort Riley? What's going on in your world?
There we go. Sorry, I was using the wrong mouse. I got a bunch of computers in my kitchen. So something that we saw on Fort Riley, and I did email KDHE about it, is for quite a while there, we quit getting positive tests for sexually transmitted infections. And to me, that's pretty alarming because I don't think people stopped having sex. But basically, they just quit having testing done. And KDHE said, yeah, we're seeing the same thing here. And so we're expecting at some point when everybody starts going back to getting tested and everything, we're going to see that those numbers have all gone up quite a bit. It is going up, but it's a lot more gradual than we were anticipating, which is good. And then we've been, where Aaron talked about the flu numbers were lower than historically they are. I wonder if that's because a lot of people were just getting their flu vaccine early, because now people are actually more concerned about these kind of things than they normally are. On Fort Riley, our main batch still hasn't delivered, so I know a lot of people have been getting them out in the community versus there with us. That was about everything that I had off the top of my head.
Okay. Thanks, Ben. Yeah, I mean, I was just thinking how coronavirus is kind of preoccupied us for the last 6 months, but STIs and everything else is still going on. So we just want to know that we're still keeping an eye on it. And yeah. Let's see. Anybody who's next? Kate, do you have something to share from your world?
No real big updates from the College of Veterinary Medicine. I think our students and faculty and staff have done a really, really nice job of taking good precautions to keep our numbers down. We have a number of laboratories and courses where we cannot socially distance and still be able to do the courses and teaching surgery and that sort of thing that we need to do. And so we had some major concerns, and we have been able to teach those courses and have those teaching experiences without disease so far, which has been really a blessing. So I think we've done really well. We have not forgotten about disease. We are a teaching hospital. We're a veterinary health center. And so we see patients every day, and our hospital has also done a fantastic job of continuing to function throughout this outbreak or this pandemic. And we're also thinking about other things that keeping things on everyone's front mind. We have Dr. Ingrid Garrison coming in next week to do a big talk on rabies to remind our students about rabies, which is another very important infectious disease that we worry about in veterinary medicine. So yes, the pandemic is on the forefront of all of our minds, but we are still thinking about a lot of other infectious disease that we see in our veterinary patients, and many of those are zoonotic as well.
That's good. That's great news. Yeah, with all the students, I have a couple of vet med friends, and yeah, they were saying course is still going well, and with everything going on, you guys are doing a great job with, yeah. And Jennifer, do you have something to tell us about where you're working?
Yeah, we still are very heavily focused on COVID. Obviously, a lot of our messaging has just been recently around like, keep doing the behaviors that you're doing that are helping us reduce our numbers. We have seen a pretty significant drop off in our asymptomatic testing. So that is something that we're hoping to try and get back up. And then just really looking towards helping prepare students for their transition back home, and then starting to kind of talk about what it's going to look like when then we bring them back in January. So lots of COVID stuff, but we're also trying to focus a little bit also on mental health as well, just because we know students have been really isolated from one another for a long time now. And so just the toll that that can take on their mental health and well-being, so.
And how are students, are they calling in for if they have any kind of mental health concerns, or, because I heard counseling services not open, right? Am I
No,
right?
counseling
Is that-
services is currently seeing patients, and they actually don't have a wait list right now. So it's been really good. We've been able to get students in fairly quickly. And then they've also started offering several different groups, and we've seen a pretty good uptake in those as well.
Okay. And I thought you guys are doing at K-State like a random drawing of students, kind of random picking of them to come in and do testing. Is that the asymptomatic testing that you were talking about?
Yeah, so we do that with our on-campus housing, like they'll randomly be selected, and then it's just voluntary to come in. But then we also opened it up, it's probably been a month or so ago, to anyone who wanted to be tested. They could schedule to come in and get a test.
All right, thank you. And
Jennifer,
then
on that, our numbers have gone down too with our the free testing that we're offering. You know, when we first did our first one in Northview, we had 500, and then it's gone down since then. I think the last one that we did, we had 2 days that we offered, and we just had 277 come through with those 2 days. It was fine. It was a steady flow. It wasn't like a big rush or anything. So it was fine. But yeah, our numbers have gone down with that too.
yeah. And Ellen, do you have something to share with us, what you're seeing?
Sure. Yeah. Kind of following on from what Kate and Jennifer said, we're very focused on COVID and how it's impacting our students and our courses. And to repeat what was said, our students are definitely feeling the impact of being alone or not seeing as many people as they usually have. So, and you know, even with the small group of students that we have, that we're responsible for, we definitely are taking care to make sure that we're reaching out to them, we're helping them, and letting them know that the services are available on campus. Jennifer mentioned the counseling. So, you know, making sure that they're aware that that's open and available, and to go get help, kind of what Robin said, that not to delay it because of your fear of going out or, you know, coming in contact with COVID, to make sure that you seek the help you need. So I think we're really focusing on that, but we're, you know, still trying to be business as usual. KPHA, Kansas Public Health Association annual meeting is online this year. So it's going to be in November. So they're accepting submissions for presentations right now. So still trying to keep all of those things we do every year going in a virtual world. So, but we're doing it. So we're getting there.
Sounds good. No bad news is good news, or no news is good news, I guess. I don't think I missed anybody, but so I know we're running out of time soon. I try to do on my own personal Facebook how to recruit for our council. Not much success there. And I don't think we have any new applications. So that's something we have to keep on working at in the next month or so. I don't know, it's Christmas coming up, Thanksgiving coming up. So any other new idea or anything we need to try to, you know, recruit for council members? Maybe it's election time too, so maybe that's more important than trying to be on a council right now.
Hey,
but Ed?
This is Ed. I posted a Facebook post for that today on our webpage and on the coalition's, Flint Hills Wellness Coalition's webpage.
Awesome.
And when you go to the county webpage, it says if you have any questions about these things, go to the clerk's office, which I really didn't do. So I left my email, and I've already received an email.
All right.
So I'll respond to that person. But it winds up going to the commission to be approved. So
right.
I don't know how much input or whatever else you guys have on who they decide to appoint, unless you get a little more involved with them directly, as far as maybe going to meet the commission at some point to re-energize the connection between the PHAC and the Board of Health, the commission, because otherwise they may just look at that and, you know, I guess it would depend on what the qualifications were and the desire and how they filled out the application, but they could wind up giving you folks that may or may not work. So you probably want to get into that system and create that relationship so you don't have to worry about that as so much. So they're coming to you to get input. I think that would be a good plan.
I think in previous, at least my experience in getting on the council was I submit my application to the county clerk, and then the clerk actually turned the applications to us in our meeting first.
Okay.
And then we look through, and then if we, you know, approve of the applicant and whatnot, then we turn it to the Board of Health, and then they give us the final approval.
If that's the way it works, that would be, that sounds like a good thing. I don't know. I mean, that might be something to also formalize though, as part of whatever procedures you guys want to create or your bylaws or whatever. But I got a response within a half an hour.
That's great. We need to keep sharing that.
So I will, and I know Ellen has commented on it. So whoever else wants to share it, that'd be great. The other question that I have for that is there are 2 locations on the county's webpage for the PHAC. Because it is an advisory council for the commission, it's on their page, but we also have it on our page. And so we kind of, you all need to kind of figure out how you want to handle that. I will give you an example of how the Food and Farm Council, which is also a council from the commission, handles it. They basically, if people want to know about serving on a council from the commission, they can go to that page and then click on the specific council. And then there'll be some kind of a information. Well, for the Food and Farm Council, they actually go back to the site that we have on our website. So it's on the commission's website, but the connection goes to the health department's website. And the advantage of that is that the health department can make changes quicker.
Okay.
So it's just something to think about, and it might not even really be an issue once we start figuring it out, but it's just something for you all to kind of look at and see how you want that to flow.
Okay.
And I did find out from the IT people who helped. I did want to let you know that I had IT update the list of members for this council on the commission site because it was not updated. So that is now updated. And it does show that we are actively looking for participants. And they had it as the Public Health Council. So I had them fix it and make it Advisory Council. So that's all on the county's website for PHAC is correct now.
Okay.
Ours was already correct because we have some access to that and can do it ourselves. So right now everything is good, and hopefully you'll get some more applicants. Yeah. And at some point, maybe you guys want to have people who are interested in being applicants come to a member of the PHAC to get information, or I can do it, or however we want to do it. We just kind of need to figure out what that process should look like, because I don't think that they can go to the clerk's office and get a lot of information specifically about the council. Okay. You know, applying is one thing, but you know, if they want to have a background so they can write up a good application, it'd be very difficult to do that through the clerk's office.
Agreed. Okay.
So there's a little bit of movement in that direction.
Any movement is great. That's yes. Great.
And I was really surprised to get such a quick response. Awesome. And I will send this person the bylaws, which give you know, talks about how she was interested in how long you would serve and really what the function is. And then the link to this YouTube Live will have the old meetings on there, so she can also watch those to get a better idea.
Okay. Thank you, Ed.
Sure.
Okay. Anything else from anyone? Then I have one other item on the agenda. It's to talk about possibly not having a November, December meeting for PHAC because of the holidays. I just want to see if you guys think that's a good idea, and then we can, and according to the bylaws, we actually don't need monthly meetings. It's once a quarter. So what do you guys think if we take November and December off and come back in January fresh and ready to go and do some public health? Thumbs up?
This is Ellen. Jenny, that could be some time. Maybe we could work via email and work on our bylaws. So we could work on that via track changes. And then when we come back in January, think about those changes.
I agree, yes. And then speaking of old business, yeah, there was that conflict of interest, the form that we were gonna look at too within the council. So we can definitely work on that. Other members, what do you think? Looks like we all agree to, okay, we can take, we'll make sure I write that down. So November, December meeting, we won't have, and then we'll reconvene in January.
This is
So-
it again. I just
Yeah.
want to let you know that we have approached the county counselor about how the bylaws need to be changed as far as the process. Haven't really gotten a response yet, so you're having a draft ready will be easier to kind of maybe move that through because you have something that you want to do, and then it's not a hypothetical. It's actually, oh yeah, they did all this work and this is what they want to do, and what do we do next?
Okay. Great. So we'll use the next 2 months to really get a draft going. Meet in January. Okay, anything else from anybody? Okay, if that's the meeting, I will call to end the meeting and adjourn at 4:57. Awesome. Thank you, everybody.
Thank you.
Great, thank you.
Bye.
Thanks. Bye.
Happy Halloween.